In the given case study, Mrs. Brown has a history of heart failure, a condition described as reduced contractility of left ventricle due to the myocardial tissue damage. This can be caused by various underlying problems, including myocardial infarction, ischemic heart disease, and hypertension. In the event of heart failure, cardiac output falls significantly due to the reduce in stroke volume. Stroke volume defined as the volume of the blood pumped out by ventricle in its contraction. As a result, less blood will be ejected from left ventricle to the aorta in its contraction. When there is less oxygenated blood available for systemic circulation, there will be low blood pressure, and it would lead to negative impact in tissue perfusion mechanism. When the barometers located in the carotid sinus and aortic sinus detects low blood pressure, a compensatory mechanism will be activated to compensate low tissue perfusion. As the sympathetic nerve system stimulates by medulla, it expresses and secretes specific hormone called epinephrine and norepinephrine via sympathetic nerve fiber. Increased sympathetic stimulation increases contractility by inducing calcium movement in the myocardium cell. Norepinephrine binds to beta-1 adrenergic receptors in the heart, causing threshold to be reached quickly. As a result, LC node fires electric signals more rapidly, and the normal heart responds by increasing its rate. But the patient with a defective heart, like Mrs. Brown, unable to keep up ventricular contraction with arterial contraction due to infraction of myocytes cell in the left ventricle. When the cardiac output falls significantly, there will be less oxygenated blood available, resulting in reduced perfusion of the kidneys, which stimulates renin-angiotensin aldosterone mechanism. This compensatory mechanism releases renin from juxtaglomerular cell, an essential substance required in formation of angiotensin II. Angiotensin II is a strong vasoconstrict agent that increases stroke volume and arterial pressure as it increases afterload. On the other hand, angiotensin II is responsible in stimulating release of aldosterone and ADH by adrenal cortex and brain respectively. When combined, stimulating action acts in kidneys, there will be retention of sodium and water, resulting increase in blood flow and the cardiac output. This action ultimately increases blood pressure, as we've seen in Mrs. Brown case. As the falling left ventricle is no longer able to pump out oxygenated blood efficiently for various reasons, including myocardium tissue damage, increase in plate load, and overstretching of the heart wall. When ejection fraction falls 40 or less, residual blood starts accumulating from its contraction in the left ventricle. The normal ejection fraction of healthy heart is between 50 to 75% and calculated by dividing stroke volume by end diastolic volume. Over the time, pulmonary circulation can no longer pass through the heart efficiently. This results in congestion of the blood into the pulmonary vein, which increases the hydrostatic pressure within the pulmonary capillaries. As the pressure increases, congested blood then leaks into pulmonary interstitial fluid, causing pulmonary edema. Pulmonary edema thickens respiratory membrane, which alters the gas exchange process, and therefore Mrs. Brown is experiencing severe shortness of breath or dyspnea. In such event, bilateral basal crackles can be heard during auscultation of lungs, as it makes harder for air to pass through bronchioles. into the alveoli and vice versa. It gets worse when the patient lies down because fluids spread all over the surface of the lung, which makes gas exchange process even harder. Therefore, patients with congested heart failure are recommended to sleep in elevated bed or sit upright as much as possible to allow gas exchange as fluid goes down due to gravity. As the poor ventilation continues, the blood will no longer able to oxygenate it as effectively as it would in normal circumstances, resulting hypoxemia as presented in Brown's cases. This is because reduced oxygen level in the blood does not perfuse tissue well enough for the vital organs, resulting further complications such as fatigue, tiredness, in worst case scenario, organ failure.